Up to 15 million Americans deal with some type of food allergy, including nearly 6 million children. That's 1 in 13 children, or roughly 2 in every classroom. So how can we treat it? Dr. Dandamudi with the Asthma Allergy Centers is here to talk about a new treatment for peanut allergies. Good morning, doctor. Thank you so much for joining us here on the show.
Nice to meet you.
Let's start with just the peanut allergy itself. Why does it seem to be the most common food allergy?
See, the families that have in general about allergies, they have a special kind of cells called as a Th2 cells. And these are the families we call as atopic families. They are more prone for allergies, asthma, and eczema. And these are the families at high risk. Why it is more common? Because we eat a lot more peanut than any other country. Our exposure is more, and they get sensitized more often.
Okay, so how is that allergy then predicted in people who are affected?
Yeah, you're right. You pick up these families who have atopic history and they are at a high risk. That is way. Then how we diagnose them with the peanut allergy? They make a special antibody called as an IgE antibody. So if you're allergic to peanut, you make a special antibody to an IgE antibody. And that antibody is fixed to the skin cells. We put a little drop of drop of peanut and then prick the skin, and that is where we diagnose allergies. And also there is a blood test that is available to confirm the diagnosis.
Okay, is it possible to prevent peanut allergies in children?
Yeah, this is a change in the recommendations now. Before we used to ask them not to introduce these highly allergenic foods like a peanut, milk, egg, fish, soy, wheat, late until year of age. But new recommendation is introduce them very early, like 4 months to 6 months. Wow. In that gap.
That is a very new recommendation.
Yes, and the way early introduction can be prevented. It prevents the development of allergies. That is the change in all our pediatricians and allergists are recommending. Introduce them very early.
Okay. See, that is the first time I've heard it. I have an 8-month-old daughter, and I have not heard that before.
Yes, for those people who are non-atopic, you can give them 4 to 6 for sure. But if the high-risk patient, if they have eczema, we have to do the skin testing and then introduce the peanut in our offices, in the doctor's office. And those people who have allergies already, there are new treatments coming for desensitization. Basically, you give a little bit at a time and gradually increase the dose.
Okay. Well, doctor, thank you so much for joining us this morning to talk to us about this. We'll have more of this on our website, of course, as well, if you need to look for it again. And we'll be right back with another look at your weather forecast.